Now we'll have a presentation from Olympic Ophthalmics.
Hello, my name is Dr. Laura Periman. I am the founder and director of Dry Eye Services and Clinical Research at Periman Eye Institute in Seattle, Washington. I am delighted to present to you the data regarding neural stimulation for enhanced tear production at OIS August 2020. These are my financial disclosures. So we have a new neural stimulation modality approved May of 2020 of this year. I had the pleasure of being involved in the phase 3 trials and the safety trials. It's now commercially available as a beta launch version. We found it to be very effective in improving Schirmer scores, but also fluorescein staining and meibomian gland scores. There's immediate, intermediate, and long-term benefits to the ocular surface with this neural stimulation approach. There's an array of positive endpoints that reflects a broader mechanism of action with neuromodulation that we're very excited about for dry eye patients. It has a very strong safety profile, and it's a high-value product in our dry eye toolkit. Here's a prototype of what it looks like, and its FDA-approved indication. It's that iTEAR neurostimulator is an electromechanical nerve stimulator device indicated for temporary use up to 30 days to increase acute tear production during vibratory stimulation of the external nasal nerve in adults under prescription of an eye care provider. Let's get into this, but first we have to remember the definition of dry eye disease. The excellent TFOS DUES 2 report updated definition has a key component that I want to point out. That very last phrase, neurosensory abnormalities play etiologic roles. This is a new component in our understanding of dry eye disease, and that's where key therapeutic devices such as the iTEAR are incredibly beneficial in our clinical practices for our patients. Because here's what's happening on a neurophysiological level. The corneal nerves constantly sample the quality of the tears, and in a healthy system, it's able to send signals to the brain, which then coordinates in response to the lacrimal gland, the meibomian gland, and the goblet cells to orchestrate a physiologically complete tear that maintains homeostasis under all environmental conditions. But in dry eye, that is offline. Well, it turns out that we can access the same trigeminal pathway through a branch of the nasociliary nerve that's alongside the lateral aspect of the nose. So in essence, we are able to fine-tune the rheostat control mechanism of a physiologically complete tear. And here's an example of neurostimulation in action. I'd like you to pay attention along the lower lid. You can see the tear meniscus height increasing. You can even see that rainbow pattern on the precorneal tear film increasing. That's meibum coming out of the meibomian glands. And if you look very closely, you can actually see tiny little beads of meibum coming out and being delivered from the meibomian glands themselves. Very exciting. So what about the primary endpoint? We looked at stimulated versus unstimulated Schirmer scores, and what we found is the following. On the bottom line in black, you see the unstimulated Schirmer scores. They all had to be below 10, so these are fairly dry eyes. And the green line represents the stimulated Schirmer score. And across the board, there's a highly statistically significant increase in stimulated tears. How about the number of patients that had at least a 10 millimeter change in their stimulated Schirmer scores? Well, again, at every time point we saw, day 14, 30, 90, and 80, there was a statistically significant improvement in the number of patients who achieved a greater than 10 millimeter increase in their Schirmer scores upon stimulation. Well, what about symptoms? Well, it turns out that there's a highly statistically significant improvement in patients' OSDI scores. The lower the score, the less symptomatic the patient is. And you can see from this graph that at every time point, day 14, 30, 90, and 180, we see a statistically significant improvement in the symptom index, OSDI. What about meibomian gland expression? Well, we used the Korb MGE evaluator and looked at the meibomian gland expressibility, and what we found was statistically significant improvements in meibomian gland expression across all of the time points, starting at day 14. And the holy grail is the number of meibomian glands yielding liquid secretions. And when you see this in peer-reviewed literature, it's abbreviated MGYLS, that beautiful olive oil consistency meibum we want to see delivered. Highly statistically significant improvements in the number of glands yielding liquid secretions at every time point. What about change in corneal staining? The table on your left shows a significant decrease in corneal staining as early as day 30, and that effect persisted through day 180. On the right, you see a patient of mine who had painful filamentary keratitis at baseline, and as early as day 14, you start to see improvement in the number of green pits, that's damage on the cornea, a decrease in the filaments, and an improvement in hair tear breakup time. At day 30, she had resolution of her painful corneal filamentary keratopathy. Artificial tear use. We asked patients to maintain their treatment regimen. However, 44% were able to decrease their dependence on artificial tears, and a quarter of them were able to get off artificial tears altogether. Patient satisfaction. The vast majority of patients were very satisfied with the product at day 30, day 90, and day 180. Even amongst the neutral or dissatisfied groups, when you did a sub-analysis of their metrics, they also had improvements in Schirmer scores, meibomian gland secretion scores, and corneal staining. Usability. This device is easy to use. Patients adapt very quickly. In clinic, you show them the activation button, you show them the vibration wheel, show them where to put it, and they're off and running. Very low amount of time required to get a patient on board with neural stimulation. Adverse events, important to continue, related or possibly related. There were very few, and the vast majority of those were mild. So in summary, we have this new method of neuromodulation that has a variety of positive endpoints. Number one, Schirmer scores, but also meibomian gland scores and also corneal staining. So this becomes a way of stimulating a physiologic improvement in the ocular surface. It's effective for immediate and intermediate and long-term relief of dry eye. We saw improvements across the board at all the time points, even out to day 180. With an excellent safety profile, we did not see any impact on blood pressure, oxygenation, heart rate, any physiologic measures. It seems to be very specific to stimulating the trigeminal nerve pathway to orchestrate a physiologically complete tear. So to me, this has become a very high value addition to my dry eye toolkit. Patients love it, they adapt to it quickly, and they really appreciate the long-lasting symptom relief. Thank you for your kind attention.